name is Jaanvi Reddy Muchanthla, and I'm a junior at Nova High School. Being a social justice fellow has been an incredibly fulfilling experience. I've gotten to speak with so many passionate and talented individuals from all over Southeast Michigan about what race implicates in our society. And those inquisitive conversations have made me think a lot about how race intersects with my passions and intersects with the issues we see in our communities. So today, I want to talk about race and mental health, how they interact, and the racial disparities that exist in the mental health experience. Living through a pandemic and also through my own study of cultural health disparities, I've come to understand how important and interconnected race and health are. Race is actually a very impactful social determinant of health, and according to Healthy People 2020, a social determinant is basically parts of your living conditions, parts of your own identity, and their social implications that impact your health and your healthcare experiences. As an aspiring psychiatrist, I can truly talk about this topic for hours. However, as we are beginning our exploration, today let's just talk about four disparities that are important to understand. So let's talk about access and usage, stigma and alienation within the system and within communities, diagnosis, and racial trauma and how that fits into all of this. Okay, so access and usage. To put it simply, racial minorities have less access to mental health services and underutilize them. A contributing factor to this is insurance. Non-white Hispanics and Black Americans are less likely to be insured than white Americans, making mental health care services less accessible. In this conversation about lack of access and underutilization, something that also plays into this is stigma of mental health within communities and feelings of alienation by the system. Numerous studies have shown that stigma around mental illness is higher among communities of color, and I can definitely attest to this. As an Indian American and a general member of the Asian community, I have been confronted with the traditional ideologies about avoiding shame and emotional restraint that are in direct juxtaposition with my passions for mental health. And it makes it understandable why Asian Americans seek out mental health care services much less than other minorities. Regarding alienation from the system, many things fall under this umbrella. For example, not having one's cultural and holistic healthcare practices being taken into account, especially when it's in a Western allopathic healthcare setting. Additionally, language barriers is a reason why many minorities feel uncomfortable in mental health care spaces. Physician-patient communication can also differ substantially by race. One study found that physicians were 23% more verbally dominant and engaged in 33% less patient-centered communication with Black patients than with white patients. This data implies that within the mental health care system, providers can perpetuate disparities in how they treat their patients. This makes mental health care less approachable and less comfortable for minority populations. These misunderstandings amongst physicians and patients can manifest into disparities in diagnosis. For instance, compared with white patients with the same symptoms, African Americans are more frequently diagnosed with schizophrenia and less diagnosed with mood disorders such as depression. Furthermore, racial trauma and general racial discrimination can negatively impact one's mental health. Frequent experiences of racial discrimination have been associated with self-reports of lower perceived social status. In fact, as part of a study of African American adults living in Jackson, Mississippi in 2012, Subramaniama and colleagues found that lower perceived social status reports among some of these adults was associated with a greater risk of reporting symptoms of depression. On another note, the postings and recordings of racially traumatic events on social media and those becoming widespread have also served to re-traumatize those who experience that reality. I observed this trend, especially after George Floyd's murder and the heights of Black Lives Matter during 2020 and 2021. Also, the racial trauma that Southeast Asians and East Asians have been experiencing as a result of widespread xenophobic hate crimes during the COVID-19 pandemic. While these mobilizations on social media for these causes have allowed for a collective response, and the recognition that racial discrimination is not an isolated incident, these events are still something to think about as we discuss how race impacts one's mental health. As we've explored these disparities, it begs the question, what's the solution to all of this? The truth is, there isn't one single answer. Racial disparities in mental health is a systemic issue, which means systemic frameworks must be dismantled if we hope to combat these disparities. Improving access to care is a good first step, as universal coverage for mental health care would significantly improve access for ethnic minorities. Additionally, having a culturally competent mental health care system is incredibly important. Cultural competency has become a very important term for me, as I hope to, as a psychiatrist, start an organization that strives to develop cultural competency amongst the mental health care workforce. Cultural competency suggests an ability of healthcare providers and healthcare organizations to understand and respond effectively to the cultural needs brought to the healthcare experience, recognizing the diversity that exists among patients. And cultural competent healthcare also benefits from having a diverse mental healthcare workforce. A more diverse workforce would likely provide not only more culturally appropriate treatment, but language skills to match those of patients. Ultimately, as described by Dr. Martin Luther King Jr., health inequity is the most shocking and inhumane form of injustice, and I truly believe that. As a future healthcare professional, I'm making it my social justice mission to make sure that everyone, regardless of race, gender, language, etc., feels seen by their mental health care providers. Thank you so much for watching.